One of the most common things I hear from new patients is, I don't care what it takes, I just want my life back. And if I'm being honest, if there's one thing I have the best success with in the office, it's helping people with headaches and migraines finally turn the corner. Not with a quick fix, but with a plan. In this episode, I'm going to show you how we approach headaches and migraines at Atlas Rising, starting with the upper cervical spine and the Blair technique, and then layering in support pieces that help the nervous system stabilize, things like nutrition, inflammation, hydration, and other recovery strategies. So a quick note before we dive in, this is educational. It's certainly not medical advice. If you're having sudden or severe symptoms or something feels different than normal, you should get evaluated right away. But if you're here because you've tried the usual answers and nothing has truly stuck, you're in the right place. I'm Dr. Endel, and this is Atlas Rising. And here we do not treat headaches like something simply to suppress. We treat them like a signal. Something your body is trying to communicate to you and to us. And when you understand the signal, you can finally stop guessing. So let's start with a simple framework that makes sense. Most headaches and migraines tend to involve some combination of three things: mechanics, neurology, and chemistry. Mechanics is structure, posture, alignment, joint motion, tension, old injuries. Neurology is the nervous system, sensitivity, stress response, brain-body signaling. And then chemistry is inflammation and metabolism, whether that's blood sugar swings, hydration, nutrient status, and there's a lot more with that. So upper cervical chiropractic fits primarily into the mechanics and neurology side of this, and when we address those properly, it can change the entire set point of how you react, how your nervous system is responding. Now let's break this down to what that actually means and why the upper neck is so often the missing piece for a lot of people. Headaches and migraines aren't just painful, they're disruptive. They steal your focus at work, they shorten your patience at home, they mess with your sleep, they drain your energy, and they create this constant low-level anxiety that people don't talk enough about. That feeling of, is this coming back tomorrow? What if I plan something and I get taken out by it? How long can I keep living like this? Now, headaches show up in different patterns. Some people call them tension headaches. Some people have migraines. Some people feel it behind the eyes. Some people feel it behind the back of the head. Some people wake up with it, and some people get it later in the afternoon. But here's a few key patterns that I want you to listen for because they really matter. Headaches that start at the base of the skull and move upward. Headaches with neck stiffness, limited range of motion in your neck, and or a locked feeling, especially at the base of the skull. Pain behind one eye, especially if it tends to be one-sided. Jaw clenching or grinding or tension in the face and temples. That band of pressure across the forehead. Headaches that show up after a lot of screen time or driving or in general stressful days. Migraines that come with light sensitivity, sound sensitivity, nausea, brain fog. Headaches that seem to be tied to sleep, whether it's not enough or just poor quality sleep. Headaches that show up after workouts or after a posture-heavy day. Now, an important safety note. If you're experiencing the worst headache of your life, it's a sudden onset. It comes with fainting or fever or other strange neurological symptoms like weakness, numbness, slurred speech, vision changes. That's not a listen to this podcast situation. That's a go get evaluated situation. But for most people dealing with recurring headaches and migraines, what we're dealing with is a pattern. And the pattern can be mapped. So let's talk about one of the biggest overlooked pieces of that map: the upper cervical connection to all of this. Your head is heavy. Think of it like a bowling ball sitting on top of your spine. The top of your spine, the upper cervical spine, is different than the rest. The top two neck bones, called the atlas and axis, are designed for a lot of motion and a lot of precision. They help your head balance, rotate, stabilize, and they sit on a region that's closely connected to the brainstem area. That matters because the brainstem is involved in regulating a lot of the autonomic functions of the body, things like stress response, balance, the set point for your nervous system. So here's the part that's easy to miss. When the upper neck loses proper alignment or motion, even subtly, the body adapts. Muscles tighten to stabilize, posture shifts, joints become irritated, and the nervous system begins responding to abnormal input. And for some people, for a lot of people, that shows up as headaches. Now, I'm not saying every headache is caused by the upper neck. That would be way too simple. What I'm saying is this. In a very high percentage of people who have chronic headaches or migraines, especially those with a history of whiplash, concussion, sports impacts, falls, years of posture strain, the upper cervical spine becomes a major contributor. And then there's a loop that happens. Pain creates tension. Tension changes mechanics. Mechanics aggravate the nervous system, and the nervous system becomes more sensitive. And then the threshold for headaches goes down, and you don't just have a headache problem. You have a system that's become more reactive, and that's why random fixes don't hold. You might be treating the output without changing the input. And at Atlas Rising, we're interested in the input. What's driving the signal? Because your body isn't broken, it's adapting. And the goal to change is what's adapting to. That's where upper cervical work comes in. This is where I want to be really clear. Medication can absolutely be necessary. It can be useful, and I'm not here to shame anyone for using it. But we also see a lot of people who don't want to use medication. And if all we ever do is try to shut the alarm off, we're ignoring the reason that the alarm is going in the first place. It's like turning down the smoke detector when the kitchen is on fire. And a lot of people say, it helps, but it comes back. I don't want to be on this forever. I've tried everything. I just want to understand why this is happening. That why is the most empowering question you can ask. Because once you find the driver, you can build a plan, not just a guessing game of when it's going to happen. So now let's talk about why Blair upper cervical care is different and why it's the approach that I most trust for this category in helping people with headaches and migraines. So what makes Blair different? Most people think chiropractic equals twisting and cracking. Upper cervical chiropractic is really a different type of category. And the Blair technique is one of the most precise approaches within upper cervical, that category. So here's the basic concept. The upper cervical spine doesn't misalign the same way in every person. The angles of your anatomy, the shape of the joints is completely different from one person to the other. The pattern of misalignment is different from one person to another. So Blair is built around understanding your specific anatomy and correcting your specific pattern, not forcing into a generic adjustment that you get the same every time you come in and the same that everyone else gets when they come in. This is why Blair often used imaging when appropriate, because precision matters. Guessing isn't good enough in the most delicate part of the spine. So now let's talk about what most people are nervous about. The adjustment. Blair is not about force. It's very gentle and specific. Most patients are surprised at how subtle it feels. I hear all the time, that's it? And that's because it's not designed to be dramatic. It's designed to be accurate. And here's a huge concept in upper cervical. A win isn't getting adjusted constantly. A win is when your body is holding the correction and you don't need to get adjusted every time. Because if you hold it, the nervous system starts to calm down. The muscles begin to unwind. Posture begins to normalize. The system becomes less reactive. And over time, that can lead to fewer headaches, less intense migraines, and a higher threshold for stress and the triggers that come. That's why we check, we measure, we correct when it's needed. We don't chase your symptoms every day. We build stability. And here's the Atlas Rising piece. Even the best correction won't hold if the rest of the system is constantly being thrown off. That's why we also look at the stack that drives headaches. So let's zoom out a little bit. When someone comes in to Atlas Rising with headaches or migraines, we typically think in 3 different buckets: structural, neurological, chemical. So structural is what's happening physically: upper cervical alignment, posture, jaw tension, old injuries, desk work, driving, how you hold your shoulders, even how your spine balances under your head. This is where Blair can be the cornerstone for the right person. Neurologic is how reactive the nervous system is. If you're living in flight or fight, like most of us, if your sleep is light, if you feel wired but tired, if your body is constantly braced, your threshold for headaches and migraines goes down, which makes it a lot easier for you to get them. And then there's chemical, metabolism and inflammation. And this is where nutrition really matters, because for a lot of people, headaches are amplified by things like blood sugar swings, dehydration or low electrolytes, chronic inflammation, nutrient insufficiencies, food triggers that haven't been clearly identified, and even gut issues that keeps the immune system turned on when it's not supposed to be. So let me make this practical. If somebody is skipping meals, running on coffee, crashing midday, their nervous system is going to be more reactive. If somebody is underhydrated, low on minerals, they can be more headache prone. If someone is inflamed, sleep deprived, stressed, the threshold keeps getting lower and lower. So when we combine upper cervical care with a nutrition strategy that stabilizes the system, that's when things really start to shift. Because now we're not just correcting alignment, we're changing the internal environment and the nervous system that it lives in. And depending on the person, we may also use other supportive therapies to help the body actually unwind and recover. Many people with chronic headaches have deep guarding in the neck, shoulders, especially around the base of the skull. So when appropriate, we support those tissues, the recovery side and the nervous system side. Because again, the goal is not to just chase the headache or the pain. The goal is to make you less triggerable, to raise your resilience, to help you feel like you can start to trust your body again. That's Atlas Rising. It's not random care, it's an actual plan. So what to expect if you want help? What does this look like if you're considering care? We start with clarity. We want to understand the story. When did the headaches start? What triggers them? What relieves them? Let's really dig into any injuries, any posture patterns, any sleep issues, digestive issues, any stress patterns, blood sugar swings. We do the appropriate exams and testing. And if upper cervical involvement is suspected, we evaluate, we correct using the Blair approach in a way that's specific to you. From there, the plan isn't endless chiropractic. The plan is correct what needs to be corrected, support the nervous system, stabilize the chemistry side through nutrition and lifestyle anchors, track the outcomes with real metrics, because what we're looking for, fewer headache days, less intensity, shorter duration, better sleep, less neck tension, a lot more mental clarity, and overall more resilience. Some people feel change quickly. Others unwind in layers because the system has been compensating for such a long time. But the goal is always the same: progress you can measure and change that holds. If headaches or migraines are controlling your schedule, you don't have to normalize that. And if you've tried the usual answers and nothing has truly stuck, this could be the missing piece. Because sometimes the problem isn't that your body is broken. Sometimes it's that the signal has been distorted and nobody has evaluated the right place yet. So if you want help mapping your pattern, book a consultation at Atlas Rising. We'll help you determine whether the upper cervical correction is part of your story, and we'll build a plan that fits your body. Thanks for listening, and if this podcast helped you, share it with somebody who's been living with headaches and thinks it's just how it is and how they have to live. It doesn't have to be. We'll see you next time.